What is a standardized court protocol for TB diagnosis? Imagine trying to see the tiniest details inside the lungs that a regular X-ray might miss. That's where a specialized court scan comes into play when doctors are looking for tuberculosis. A standardized court protocol for tuberculosis diagnosis is not something used all the time but is very helpful in specific situations. It is mainly used to get a clearer picture when chest X-rays are not enough or when other diseases like cancer or fungal infections are suspected. This protocol involves using high-resolution computed tomography scans, which provide detailed images of the lung tissue. Sometimes contrast dye is used to better see lymph nodes, the lining around the lungs, or to tell active inflammation from old, healed damage. The scans are usually taken in thin slices, called thin section scans, to see even the smallest abnormalities. These images are then reconstructed in multiple planes to give a comprehensive view of the lungs, mediastinum, and pleura. When looking at these images, radiologists focus on features typical of active tuberculosis, like small nodules near the airways, patterns called tree and bud that suggest infection spread, areas of lung tissue that are filled with fluid or air, and enlarged lymph nodes that may have dead tissue inside. They also look for signs of healed disease, such as scars, calcified nodules, or damage to the airways. It is important to remember that a court scan alone cannot confirm tuberculosis. The findings must be combined with clinical symptoms like a cough lasting more than 3 weeks, weight loss, fever, and laboratory tests such as sputum smears, cultures, or molecular tests. If the court shows signs of active disease in a patient with symptoms, doctors may start treatment even before lab results come back, but confirmation is always preferred. The court is also useful for monitoring how well the treatment is working and for spotting complications like lung scarring or persistent cavities that might need more attention. Overall, a standardized court protocol for tuberculosis is about using detailed imaging to support diagnosis and management, especially when initial tests are inconclusive. It complements other tests and clinical information, helping doctors make the best decisions for each patient. Always consult healthcare professionals for personalized advice, as each case can be quite different.